Hi, I'm Professor Dr. Faraz Farishta. I'm back again with this new episode. Today, I'm going to talk about, I would say, the most important aspect of a diabetic patient: diet. Diet and diabetes. I think these two D's go together very, very well. And then we have abused the diet. We have made the maximum usage of diets for ages and centuries as a human being. One thing which we all love is feasting. So that then there comes the point of what diet a diabetic patient should take so that his sugars are under control, and then that he is also feeling satiety. At the same time, the pleasure of having the diet should always be there. I'll just tell you quickly, when you see a food, there is a neurohormonal axis which gets stimulated, and then there is a release of a hormone called ghrelin. So that tells you that yes, if you see a food or if you smell the food, that releases, and that tells you that I want to eat that. So that pleasure, that hormone should also be there. So a common things for diabetic patients, I would say, most of the national and international guidelines have said that if you have a normal plate, you divide it into three parts. One part, so basically you divide first into 50 and 50, and then 25 and 25. The 50 part, what you are dividing should be greens. So it should have a good amount of vegetables. And then you can have a limited amount of certain times fruits as well. The other 25 part, you can have carbohydrates. So you can have rice, you can have roti, you can have the other carbs if you want. The other 25 part is has to be protein. So it has to be dal if you're non-vegetarian. It could be chicken, it could be lean meat, which is very good for diabetic patients. So you have to make your plate colorful. So colorful doesn't mean you color your plate. I say you should have fruits, you should have vegetables, you can have dal, you can have small body cup of curry. And then to that, in the end, yes, if you want, you can also have a cup of curd as well. These is very, very simple for most of the patients. Things which they should not have is things which have a high glycemic index, which has high glycemic variability. So things, to make it very simple, vegetables which are underground. So the root vegetables like potato, carrot, sweet potato, these all you have to reduce the quantity so that you do not have a spurge in your sugars when you're taking it. Try to avoid it, or even if you're taking it, it's okay. Have it in a limited amount of quantity. All the green vegetables, you can have it in good quantity, so there is no problem with the green vegetables. Coming to the fruits, you can have watermelon, you can have apple, you can have papaya, you can have mosambi, you can have jam. Any of these fruits you can have. Seasonal fruits, there is always a discussion about seasonal fruits. So yes, seasonal fruits also nowadays we do tell yes as a seasonal fruit, or you can have, but that again you have to have it in a very limited quantity. So with mango season around, yes, you can have, but probably half of a mango, not more than that. And remember, any fruit you can have only one portion per day. So if you're having apple today, the next fruit can come the next day. To make it more interesting, I would say I would like to reiterate on our uh, diet, which is now, if I have to take you back ages, millets. Millets is one thing. Ages for our great grandfathers used to have millets. There was no non-communicable diseases. After the advent of industrialization, after the advent of carbohydrate rice, I think all of us are paying the price. Carbs content, carb intake, believe me, we all just feel that it is high in South India, but there was a study which was done which said that 60 to 62% of our diet across all the zones of country, north, south, east, west, we do take carbs. It could be any carb. So that is where the problem lies. So there we can replace it with millets. Millets are very good in natural source of iron, calcium. You have it, it has high fiber content, so your sugar variations would not be there. The glycemic variability of few of the millets is very, very good. So you can have ragi, you can have jawar. Nowadays, we are getting many desserts with ragi and jawar. You're getting fast foods with ragi and jawar. You can have your idlis, your dosas, upmas in breakfast, or because of or with all these millets. So millets are one good thing which now the our ICMR also recommends, that one meal per day you can replace it with millets, with some quantity, a portion of quantity with millets. Even a healthy individual also should be advised to take millets, because it is a high rich in fiber. So the problem with carb and the other problem of weight gain will not be there with millets. And then I think even our ICMR, the government of India, is also talking a lot about millets, because we have forgotten what our ancestors used to eat. I think it is time that we go back and get that glory and start having millets. The other things about diet in a diabetic patient is, do not do overindulgence of anything. So if you are going in a party, what we tell our patients is, have at least a bowl of salad before you go there. So what happens is, if you have at least a bowl of salad, that will get your satiety down. It will prevent the sudden spurge of your sugars, which will happen when you take a high carb meal. So because salads will have high fiber content, so that will prevent the sudden absorption of sugars, which will happen with carbs. So have a bowl of salad before going to your parties. That will help you to enjoy your parties as well, and to not feel guilty about it as well. So again, signing on out on a note that yes, you can have anything which is good in nutrition, which doesn't play with your sugar spikes. Or most of the time, the common example is millets. Be very selective when you are taking foods. Whatever you are having, the rule of thumb is, have it in a limited quantity. I think the mantra is, whatever you want to have it half. So if you are feeling that if you're gonna have an entire biryani, the idea is have half of it, or if you're having half, you make it to one fourth. So cut down on the portion, so that will prevent the first purge which happens after taking a carbohydrate diet. So thank you again to all of you for joining us, and do join us next week for more talk on diabetes and the newer aspects. Thank you.